I always say that cancer, like half the battle with cancer is with what goes on in your head, because your head goes to some absolutely terrible places while you're going through treatment. All the what ifs, all the like, am I a burden? And should I even be asking the people for help? Or is this even worth it? And it's a really tough mental game. So my name is Megs. My full name is Magdalena, but I go by Megs just because it's easier. I live in Winnipeg, Canada, which is like a relatively small city in central Canada. I'm currently 23 years old. I work as a translator from French to English. Well, I lived like a pretty, I don't want to say extreme, but I lived like a really busy life. I was doing an internship for my current job. I was working evenings and weekends as a server, working closing shifts. So anyone who works closing shifts know that they're very late nights. And I was really like, pushing myself. And I just remember in November 2018, I was in the shower and I just like thought to myself, I was like, nothing's wrong. Like I can't feel that anything's wrong physically, but something's wrong. Like I don't feel good, but I obviously couldn't pinpoint it. And then I kind of like let that go. And then January, I started getting like a few weird symptoms. Like I'd get these really bad aura migraines like quite often, whereas I would usually only get them once every few months. But again, really thought nothing of it. It was like exam season. So it's like, okay, I'm probably just really stressed. And then what really set it off was, it was about beginning of February 2019. And then I noticed that I had a really, really bad cough, but that's not really uncommon here, especially when it's that cold. And then I also had swelling in my left arm. And I thought that that was just for me like leaning on my office chair, because that's what I did at work. So I figured I must have just like tweaked a nerve, or like it was just like cutting off circulation. But then I was at the gym and I noticed that it was just completely blue. Looked like a whole massive bruise, and it didn't feel like a bruise, it just felt like tingling. So I went to a walk-in clinic the next day because I was like, this is not normal. And she asked me all the questions, and one of them was, does cancer run in your family? Which it did, unfortunately. But there was not like, no, she didn't alarm me of anything, so I just kind of thought it was just one of the questions that she asked, along with like the other questions. And she sent me for a blood test and an x-ray, and then it came back as there was inflammation in my lungs. So she's like, okay, it's probably like some sort of a like a lung infection or something like that. I'll give you antibiotics. When you're done the antibiotics, go sorry, for a follow-up x-ray. I did that. I felt totally fine. Swelling went down. And I almost didn't go for the x-ray because I was like, I feel totally fine, like I'm good. And then I went, thankfully I did. The next day I got a really cryptic phone call from a hospital saying, hey, you have a CT scan tomorrow morning at 8 a.m. or something. And I was like, I think you have the wrong number. And they're like, nope, this is for you. So then I went to the CT scan. I was like, what's going on? And then the doctor called me, the one that I went to at the walk-in, and was like, hey, there was a mass on your lung. You have an appointment with a thoracic surgeon, so a surgeon who works like neck and chest area, and then he'll further explain what's going on. I, again, like, was a little bit, I was like, hey, something's wrong, but like cancer was not top of mind. It was like, okay, maybe there's some sort of growth or a cyst or something. I don't know. So I kind of went in there by myself, all like jolly and happy. And I was like, okay, cool, let's get this over with and go to work. And like right away, he sat me down, and he was like the sweetest gentleman. He sat me down and looked me in the eye and like grabbed both my hands and was like, you have a pretty big mass on your right lung. And he's like, there's 3 possibilities and all 3 are cancers. So that right away was like, open my eyes. I was like, that is not what I was expecting to hear. And then the biopsy just confirmed the diagnosis. Yeah, so I basically just didn't go to work. I went home and I was just so numb. I literally sat on the couch, I think, and cried for the rest of the day. I just really didn't. I was like, I can't believe that this is actually happening right now. And I contacted a friend of mine that I went to high school with, who had just finished fighting cancer, I think a couple months prior. And I was like, she's the only person that would honestly get it at this point. So I messaged her and I was like, I'm going through a scare right now. And she basically was like, whatever it is, like, I'll help you through it. Don't worry. Like, don't, Google, don't think about things until you know what's going on, because you're just going to cause yourself extra stress. So basically the biopsy, they asked us to come in, and because it was considered an like emergency surgery, the operating room was all booked up, but they were like, we need to get this done as soon as we can. So they were like, you're gonna come and we're just gonna kind of wait in the hospital until we have an opening and put you in. So the next morning I went all scared and nervous, crying the whole way there, because I was like, I don't know what's going on. And it was just like, anyone who stayed at the hospital knows it's like nerve-wracking. And just, yeah, I remember I couldn't sleep that night. And the next morning I woke up and it was a little scary for me because I'm really good with needles. I'm good with medical procedures. Like, that's fine as long as I know what's happening. But for me, they kind of told me, we just because of where the tumor is, it's like under your rib cage on top of your lung, and there's just so many vital organs and stuff in this area that we don't know exactly where we're going to do the incision, exactly how big it is, how many incisions. So yeah, they basically were like, we don't really know what we're getting ourselves into until we cut you open, as scary as that sounds. But I mean, at that point you kind of say like, do whatever you have to do. And yeah, they wheeled me in, and I just remember I was like so nervous, but you just kind of have to let go and trust that you're in good hands, that everything will be okay. Luckily it went really well. I have a small incision right here on my chest, you can kind of see. That was their first try, and they were able to get whatever they got from there. And it was good. I stayed in the hospital for a few hours, and then after I caught up and ate, they let me go home for the rest of the night, got nice painkillers to help me through. I think recovery was also pretty tough just because you don't really think about it, but in this area, like, it affects your arm, it affects your chest, it affects your abdomen, and I couldn't really move around. So the recovery was tough. I couldn't do a lot. So it was about, I think, a 2-week period, which is actually a really long time for biopsy results. I'm not sure why that happened, but yeah, it was nerve-wracking. I think a lot of it was distraction because I was in pain. So I kind of just I tried to relax. I tried to let myself heal. My objective was to have the smallest scar possible. So I was really trying not to overdo it. And then I remember I went back to work, and I just kind of tried to keep my mind occupied. I feel like, I can't exactly remember, but I feel like I had already accepted that it was probably cancer at that point. I'm just like one of those people where I'm just like, okay, like, I accept it and let's move on and get it over with. So that's from what I remember. That's how I thought. And I was just waiting for a phone call from the surgeon. Basically, that's what I was waiting for. And I was sitting at work one day, and his nurse called me and said, "Hey, we need you to come in for the results." The way he put it is, he was like, "I'm not a specialist, so I don't want to give you wrong information." So he's like, "You have lymphoma. The tumor is X by X size. It's located in exactly this area." That's about all the information he gave me. And they left the room, and I saw that they had a paper, and I took a picture of the paper, and that paper had not official, but like, they thought it was primary mediastinal large B-cell lymphoma, and a few more like scientific-y medical terms on it that I didn't really know, later Googled, but I kind of, yeah, had to figure it out on my own. So I had a scan the morning, like right before I met the oncologist. So I had the MUGA scan for the heart, just to see how my heart was doing and whether there was any blockage to like the blood in my heart. And then after I had met with her, there was a whole initial appointment of, this drug is going to do this to you, this drug is going to do this is what's happening. And then after that, I think I had, CT scan, and then a PET scan. CT scan's the easiest. But also probably the most uncomfortable. So it's just like one of those big donut tubes. You go in, you go out a few times, you hold your breath a few times. They gave me this thing called contrast. So I've seen some people have to drink something. I never had to drink anything. I just get this IV contrast, which is basically like, honestly, I don't even know. It's something that like shows it better in your body. And when they put it through, it gives you this sensation of a hot flash from head to toe, and you feel like you just peed yourself. You never do, but it's the most uncomfortable feeling in the world. So that's that scan. It's super quick. It usually is only like 15 minutes. PET scan is basically like a more detailed version, specifically, I think, for cancer cells. I'm not sure if they use it for other things. Same kind of thing. They put like this radioactive sugar into your blood, and because cancer cells love glucose, they attach and it lights up exactly where there's cancer in the body. So that's usually the scan that people will have throughout their treatment, just to see if the tumors are shrinking or the cancer is, and stuff like that. That one's a little longer. It's about, I'd say, an hour and a half, because you have to wait for the sugar to go through your body, and then you go in the donut shaped machine for like 20-ish minutes. The way she put it is, we already know what the diagnosis is, we know what the staging is. Before we start, we just want to make sure that we have all the possible information. So she's like, I just want to do one last MUGA scan, one last CT scan, to see if it has grown, to see how like aggressive it is from the first one, which was like a couple weeks before, I think. So that was just her. She just wanted the best understanding possible. And then they basically called me and were like, hey, you're starting chemo on Wednesday. So I went to the hospital, I got the blood work done, and they split my first one into 2 days just because they didn't want to overwhelm my body. So I went one afternoon. I think I got 3 out of the 6. So I got, or 3 out of the 5. And then that one I didn't really have any side effects from. I just remember being all chipper and sitting in the chemo room and everyone's kind of looking at me like, why is this girl so happy? And I was just like, let's just get this over with. Like, this is what I have to do now. Let's just do it. My boyfriend was there. We were vlogging and we were just having a good time. And luckily the nurses at the hospital that I was at were all super like happy-go-lucky, joking around. And that's like what you need. I think nurses are, if there's a happy nurse, that just makes all the difference. And yeah, so she was like telling me what was going to happen, but also making jokes and making conversation. And it was just like so chill, I want to say. Like, I didn't really even feel like I was getting chemo. Went home that night and I just felt like the sinus, like the weird, you feel like your head's just clogged up. So yeah, I would go in usually in the morning at around 9 and I'd probably leave at around 2. So yeah, they were able to give me the infusions in larger doses, I guess, or quicker. As I got along and if my bloods were okay. So yeah, 9 to 2 and then 3 weeks. So it took me about a week to recover, and then the 2 weeks I'd feel okay, and then another infusion. Usually that evening I'd still feel pretty okay. The next morning is usually when everything hit. I had a really bad nausea and I was very sensitive to smells. So for the longest time we couldn't cook anything that had any sort of a smell because I would just get so sick and I wouldn't be able to look at that food forever. And then I don't know if this is common, but for me, the first meal that I would eat after treatment, when I would get nauseous, it's like my brain would associate the nausea from that meal. So I couldn't even look at like hot dogs or anything for a very long time if I had one right after treatment. But that, I got really bad headaches all the time from the chemo. I had mouth sores for a little bit. Those were absolutely terrible. I would get like numbness as well. I think that's it for like the really bad ones that I could remember. I'm sure there's a bunch of like smaller ones. I remember my stomach started getting like super like acid reflux and stuff, so I had to get different medications for those. But as far as like how I treated things, so I did get medications from the hospital for nausea, but I did find out they didn't really help me. What did help me was ginger. So I would take ginger pills or drink ginger tea. That really helped me. Also just snacking on foods that were small portions. I found that if I got myself to be full, then I would get even more sick from it. So I would just do like smaller snacks throughout the day just to keep my stomach, like there's something in my stomach, but I'm not necessarily full. And it was just like a lot of like crackers, bagels, popcorn, like anything that was carby that could like help me feel full, but that didn't necessarily have a smell. For the headaches, I tried like a million different things. I really didn't want to take T3s or any strong drugs because to me, I was like, I'm already on too many drugs. I don't want to take any more unless it's absolutely necessary. So I would do like cold baths or hot baths depending on how I was feeling. I always had like a wet towel on my head. I've even tried using essential oils to help with like the headaches. On the topic of mouth sores, someone did tell me after I finished chemo that apparently if you chew on ice while you're getting your injections, that helps somehow. So I
Yeah.
know lots of people would just bring ice, and I never tried it, but I mean, it's worth trying to avoid mouth sores. When I remember like talking to a friend and they were like, oh, well, have you started losing hair yet? And I was like, no, like this is awesome. Like all my hair's still here. I feel great. Like my next chemo's in a week and I still haven't lost any hair. This is awesome. And then the next morning I was just like sitting on my computer working from home and I was kind of like had my hands in my hair and I just pulled out like a clump and I was like, oh no, here we go. So I went to the bathroom and of course did the whole like woo, and yeah, a bunch of hair came out. It wasn't crazy at first. It was just like a few, like 5 hairs at a time, which still is a big deal when you're losing your hair. And I just kind of left it and I was like, you know what, I'm going to just hold on to it as long as I can. Next morning it was all over my hoodie, and then I think like 2 more days after that it was just everywhere. It was unbearable. I would literally be outside in the wind and you would just see hair coming out. And so then I called. I was like, I need to get rid of this because at that point it's just more painful watching your hair fall out. For me, it was just mentally harder just to see blonde hair everywhere and keep vacuuming. And I had really long blonde hair. I did end up cutting it to my shoulders for a bit. and then just to kind of see what it would look like, just because I always wanted shoulder length hair. So I was like, might as well, it's gonna fall out. I also dyed my hair gray because I was like, oh, why not? I don't care about damage at this point. And yeah, and then after about 6 days, I had to take it all off. And then by the time I went to see the hairdresser who shaved my head, I already had bald patches on both sides, and right over the top there was a nice big bald patch. So it looked pretty sad. After my first round of chemo, I did return to work, and I just found it to be really hard. I couldn't concentrate, and being a translator, you need to be on your game. You need to provide good quality, and I just knew that I wouldn't be able to give them the best quality work. I didn't want that to affect my future if I wanted to work there. I also wanted to be able to recover and take a nap whenever I wanted to. So I just have figured that it was the best situation for everyone if I just took time off. I went from living a very, very active lifestyle to essentially being couch bound for a very long time. So it is a huge adjustment. And for me, like, it was, again, like, emotionally, it was really hard to make that adjustment when you're used to having plans and always having something to do and somewhere to go, to laying on your couch and staring at the ceiling. So I got a scan after my fourth cycle of chemo that basically showed that there was nothing in my neck anymore, and the tumor had significantly shrunk. So it had shrunk to about 1/3 of the size. So they were like, okay, so we have 1/3 of the chemo left, 1/3 of the size. This is looking really good. And they said, we're going to continue with chemo, do another scan after that, and then we'll see. Radiation was on the table, but it wasn't like a for sure. It was just like a maybe, we'll see. So yeah, and then I did the last 2 cycles, and that after showed that there was still some type of, not activity necessarily, but they weren't sure if it was inflammation or if it was still active cancer cells. So then we did wait for a little bit. I got another scan again a few months after that. It showed that the activity was going down. So they're like, oh, we think it's just inflammation. Anyways, we're going to keep an eye on you for the next few years. So if anything comes up, we can do radiation. Essentially, it was my choice at the end of the day, but I didn't really want radiation because I just didn't want more treatment. I didn't want to affect my body even more than it already was. So I just was like, okay, if I ever need it, I'll get it. But at the moment, let's just kind of keep monitoring with scans. I had, I think, 2 more PET scans after that, and they all showed like slightly decreasing. So that just means that it's probably inflammation just all going down slowly, which is pretty common, that there's still like some sort of scar tissue there, obviously where the tumor was. And then we just decided that, yeah, we're just going to do blood work from now on. And then if I have symptoms, or if I'm not feeling good, or if I want a scan, I can get one. But as of right now, exposing me to that extra scan radiation is not necessary. So I always say that cancer, like, half the battle with cancer is with what goes on in your head, because your head goes to some absolutely terrible places while you're going through treatment. All the what ifs, all the like, am I a burden? And should I even be asking the people for help? Or is this even worth it? And it's a really tough mental game. Positivity and positive mindset really did help me get through all of this. As far as survivorship goes, at first I did find it really hard. I was like, you know what, like, I'm not having treatment. Because when you go to the hospital and you get treatment, someone's checking up on you every so often, right? But if you don't, then no one's really checking up on you, and you don't know. And then you'll feel a random pain, and you'll just be like, oh my goodness, is this just a random pain? Or is my cancer back? Every time I have a cough, I'm like, is this the tumor, or am I just coughing? So that was definitely really hard for me at first. But I did find that with time it got better. Try to focus it on other stuff now, but I mean, it's possible, but I just have trust that I live in a good country with a good medical system. I can just make a phone call to the hospital and they will let me have a scan, and I am in good hands. I think I find now that I try to just steer away from, being a cancer survivor and having had cancer. Like, it's weird because everyone that knew me before knows I had cancer, but then it's like you meet new people and that's not something you really want to say. Like, like, I had cancer. So it's kind of been a good feeling realizing that I don't think about it as often anymore. And when people tell me, like, when they just finished treatment, they're like, how do you get over it? I just say, you know what, with time, you start to go back to your normal life. You feel good. You see the hair grow back. Is like, your scans are good. So you just kind of feel like you're good. You're in the clear. And as long as you keep doing what you're doing, you'll be fine.